provider, in the early days of COVID-19, I felt uncertain, like everyone. I felt scared for my clients. I felt scared for myself. My clients were uncertain about their jobs, and they were worried about safety. During the pandemic, isolation has been a huge issue for, I would say, probably about 70 to 80% of my clients, because they thrive in being able to connect to their communities. They thrive in being able to find the places where they can access the resources that are going to help them through some of the most difficult times in their life. And that sense of feeling not alone with what we struggle with is so important in healing, that when that went away abruptly, literally overnight for some of us, it became very difficult to access that within ourselves.
There is a strong connection between mental health and physical health. And we know that during this pandemic, that COVID-19 has really taken a toll on people. It's affected their sleep and their ability to relax and their nutrition. And with all the uncertainty and inability to control their situation, it's worsened a lot of physical symptoms.
Over the past year, I've seen a lot of thankfulness because we never closed our doors. We were always available to the community. We had to rearrange our schedules to meet the community needs, such as going to visit the homes and different things, doing curbside things and things of that nature. But the point is, we never closed our doors. And so that kind of gave the patients reassurance that they still had somewhere to go.
The Sisters program is responding to the acute needs of women in the street-based sex trade who basically are often struggling with a number of issues that are really structural and systemic in nature. So poverty and childhood trauma and substance use that results from those experiences, often unchecked and unhealed, and dealing with the fallout from that, which is women who are oftentimes trapped in a cycle of sex work and sex trade and substance use, with mental health issues sometimes on board as well. During COVID-19, the challenges that our clients faced, which were already many, really were heightened and exacerbated, especially in the sense of overdoses and extreme violence directed their ways on the streets. It's been a very difficult time for many of them. So we connect with women both on an outreach basis out on the streets and in our drop-in centers.
I think in order to help people to dealing with mental health is to let them know they're not alone, to let them know that there is help out there. Even for us as the workers, like would have meetings, we would come together and we would talk about different things. There was moments that I cried. There was moments that I didn't know, it was just the uncertainty of everything and just seeing the sadness of people in their families and things. It took a toll on us as well. So just being able to have one and we can talk to each other and just be a supportive team for each other.
United Way and the Milwaukee Healthcare Partnership support the Health Improvement Fund. The Health Improvement Fund provides critical support to Walker's Point Community Clinic, the Bread of Healing Clinic, the Benedict Center, and others that make up the healthcare safety net. Donations to the Health Improvement Fund help nonprofit clinics provide critical health services, including mental and behavioral health, to the most vulnerable of our community.